This is our therapy dog Fludo. He works in a school for children with developmental disabilities like autism and Down syndrome. There are also children here who have a lot of problems with attention, who are very hyperactive, and Fludo helps all of them reach their goals. Right, Fludo?
कौन है हाँ? Fludo, very nice. झोपायचं तुला डॉगी. प्रगती. Very nice. किती पाय मोज? 1, 2, 3, 4. किती पाय आहे डॉगीला? 4. आणि कान कुठे आहे डॉगीचा कान? किती कान आहे मोज? 2. Superb.
One of the main things that we work at in group sessions are social skills, because the dog becomes a common medium, a common area of conversation for the children. If we had to just come and make the children sit in a circle, and if we didn't have the dog, it would become extremely awkward. So when we have Fludo sitting here, they talk about him, they pet him, they ask us questions about him. How old is he? What is his name? What does he like to eat? They all of them have to feed him, brush him, and when they have to ask each other for the biscuit, or they have to ask each other for the brush. So this sort of encourages them to talk to each other and to interact with each other.
हे काय आहे? डॉगीचा पाय कुठे दाखव? व्हेरी गुड. डॉगीला दाखव काय बनवलं तू?
We started animal assisted therapy in our school. What we've noticed is there's definitely been a progress. You know, in the beginning it was gradual, but children who were earlier non-verbal started smiling more, waving out to me at the end of the day, and loudly saying bye, vocalizing. And even the other children, there's been an improvement in the behavior, hyperactive. They've been calmer. And some children have developed a lot in their concentration. Like, for example, Pragati Masika. She started opening out a lot. Actually, she's a very quiet child and she's non-verbal. But she started opening out, interacting with the group, the children, the staff, applying a lot of dedication to a particular task at hand.
Come doggy. Come. Let's go बोल. चल बोल चल. चल.
Okay.
Very good.
Right, these are that.
Da.
Some of the activities that we have, like jumping with Fludo over a stick, or even taking him for a walk. Many of these children have very poor motor skills and they have to work on their motor movements. But whenever they have to do something, like whenever they have to do an activity that requires any kind of physical activity, they get irritated, they get bored, they don't want to do it, there's no motivation to do it. But here, because of Fludo, they don't feel as though it is an activity. They enjoy doing it with him. So when they are walking with him over a stick, they don't realize that it is improving their motor skills. We don't force them. They like doing it, it's fun for them. That's one of the main reasons that parents like sending their children over for therapy, because in animal assisted therapy, when there's a dog involved, the children don't feel it's a regular therapy session. Whenever they come into our room, they'll be always happy, they'll be smiling, they'll be laughing. And many parents tell us that usually whenever they say therapy, the child gets cranky or irritable. But with the dog, it becomes fun. So our sessions are not seen as therapy, they're seen as fun and games with our dogs.